Welcome to another episode of SPED Talks with me, Donna Steele. In this episode, we will look at part 3 of 3. We will focus on those remaining eligibility categories as defined by IDEA or the Jamaican Ministry of Education. So the 4 categories that we look at today are orthopedic impairment, traumatic brain injury, speech language impairment, as well as other health impairment, not particular in the order that I just gave you. So without further ado, let's get to it. Hey guys, so we're going to start by looking at orthopedic impairment. And as the name suggests, this has to do with bones, joints, or muscle-related disabilities. It is one that is so severe that it negatively affects a child's educational performance. Much of it can be caused by just birth defects. So during birth, you have varying anomalies during birth, as the word suggests, congenital during infancy. Disease such as poliomyelitis, bone tuberculosis, as well as other causes ranging from amputations, fractures, as well as cerebral palsy. The characteristics include, it's difficult to really generalize these characteristics just because the category has a long range of different disabilities that fall under orthopedic impairment, but I will try to provide some examples and a few here. For example, a child with a spinal cord injury could have immobility limited to one side of his or her body, just the arms or legs, or total paralysis, while a child with cerebral palsy may have movement but need a wheelchair since walking may be difficult. So you cannot really put the characteristics vary depending on what the child has been diagnosed with specifically. So the characteristics will not necessarily be the same as shown in these 2 examples. The impact of having an orthopedic impairment in the classroom may have no cognitive concerns, meaning their cognitive functioning is okay, their IQ is normal or even above normal. So that might not be a concern. If appropriate, student may be integrated into the general education setting all the time. They may use assistive technology depending on what their specific diagnoses are, rather. Again, let me stress that they may not have cognitive concerns. So just because a child is in a wheelchair doesn't necessarily mean the child has limited cognition and the child isn't able to academically thrive in such a setting. That child may have an IQ above you or myself, you know. So, and I think when people think of kids who has orthopedic challenges, we normally think that their brain doesn't work and they're not able to produce work of good quality. So let's dispel that myth right now. So a student with orthopedic challenges, they can fit right into the general education setting if appropriate. So if a student who is in a wheelchair, one would expect that the general education setting would have the requisite infrastructure to accommodate such a student so that his or her educational needs can be met and they can realize their true potential. Other health impairment. And this, as defined by IDEA, is having limited strength, vitality, or alertness with respect to the educational environment. That is due to whether chronic or acute health problems, such as asthma, something that we take for granted. A student who has severe asthma could be considered a special needs student if it does affect them educationally. Attention deficit or disorder, teachers, come on, we've seen this all the time, or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, and it goes on and on, leukemia, rheumatic fever, sickle cell anemia. All of these could fall under the category of other health impairment if it does limit a student from performing at his or her utmost, and their education needs are not being met. Adversely affects a student's educational performance. Yes, it does. The characteristics may include fatigue, mobility issues, issues around attention, coordination difficulties, muscle weaknesses, lack of stamina, inability to concentrate. Even though these are put here as general characteristics, again, they are not necessarily exhaustive in terms of what is specific to a specific diagnosis. But usually with the ones that we've listed on the other page, diabetes, heart condition, we might have fatigue, we might have kids just losing stamina, hence why I've put it like this as far as characteristics are concerned. The impact of having a other health impairment diagnoses in the classroom: may not be able to attend to a task for extended periods of time. And that might again be due to fatigue or whatever is going on. Poor physical awareness. Handwriting may be challenged. Organizational concerns. Gross or fine motor concerns. Again, it's specific to the type of diagnosis that the student may receive. Brings us to speech language impairment. This is actually a common one that we see when a child stutters, when a child has a delay in his or her response to speech or articulation. It has a lot to do with language and comprehension. So speech language impairment is where a student has a language or speech disorder once it is determined that the student's disorder meets one or more of the following criteria. And I kind of alluded to it just now. So if they have an articulation disorder, if they have abnormal voice, fluency, language disorder, then they can be considered a candidate for speech or language therapy. Speech or language impairment, some of the characteristics tend to emerge at a young age. So usually when a student has a speech or language impairment, we can tell automatically, especially as parents. We may find this out very early. The diagnoses can be given at maybe 3, even earlier, because you kind of start to pick up on some of the nuances that are not necessarily in line with them their developmental milestone. May have difficulties with comprehension, may have difficulties being understood, may have difficulty expressing needs, ideas, or information, or just may struggle with social interactions. And that's where the language part comes in. The impact of having a speech language impairment in the classroom: students may capitalize on student strengths as much as possible. This is where teachers are asked to capitalize on their strengths, which we should do all the time, capitalizing on the strengths, because it will show that they are more successful when you use their strengths as much as possible. And then those areas of weaknesses will eventually start to improve. Avoid correcting speech difficulties. Avoid correcting speech difficulties. So, because what you do when you do that, you draw attention to the challenges that they do have, and their self-esteem will be bruised once you do that. So avoid as much as possible to correct those speech difficulties. Work closely with the speech language pathologist to support the student. Now, in the Jamaican situation, we don't have speech pathologists at our schools. So this impact right there, that third bullet, we may not be able to have that access. However, in the American schools, usually a speech language pathologist is on staff. Even if it's a contractual one, they do have access to such a service. In the Jamaican situation, unfortunately, it is usually a private service that parents would have to facilitate in their own time. Again, we haven't gotten to that stage where we would have access to such a person. But in that event where you would have access, if you decide to get a speech pathologist for your child, then it would be advised that you would work closely with them, and I'm pretty sure they would work closely with you to provide you with different things that you can do at home to support your child. And lastly, wow, it seems like we went a little bit fast this week. Lastly, we have traumatic brain injury. And as the name suggests, as the phrase suggests rather, traumatic brain and injury, it's an injury to the brain. As defined, we would define it as an acquired injury to the brain caused by an external physical force. So meeting in a car accident with blunt force that could cause it, resulting in total or partial functional disability or psychosocial impairment, or both, that adversely affects a student's educational performance. Applies to open or closed head injuries resulting in impairments in one or more areas such as cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities, psychosocial, physical functions, information processing, and speech. So you can think of, if the brain is affected, pretty much a lot of what we do will be affected. So if you are anyone or any student, who has a traumatic brain injury, one or more areas of the brain can be affected. And this, as you would imagine, it doesn't necessarily happen in infancy. It can happen any time of our lives. It can happen any time of a student life. You're just going out there in a vehicle, and unfortunately, God forbid, you're caught in an accident, and before you know it, you have an injury to the brain, and special education services are required. The characteristics include memory concerns, social skill concerns, emotional regulation concerns, attention concerns, speech and language concerns, physical concerns. And again, this is not the entire characteristics. It depends on the type of traumatic brain injury you have. You could have something that affects your eyes. You could have something that affects your ears. You could have something that affects your sensory aspect of how you do things. So again, it's not exhaustive. Impact of a traumatic brain injury in the classroom. A student with this may struggle to process visual information, may struggle to follow multi-step directions, may struggle to communicate, may have difficulty with grade level work, may struggle with logic, problem solving, and reasoning skills. And again, this is very specific to the part of the brain that is damaged. So again, this is not the entire impact. So with that, that concludes our eligibility categories. So there you have it, guys. The final episode concluding the eligibility categories as defined by IDEA or the Ministry of Education Special Education Unit in Jamaica. Now, just bear in mind that these topics are just a snippet of how deep it can go, because it can get really deep. This was just for the purpose of SPED Talks. Feel free to reach out to me for more information as it relates to strategies that can be used in classrooms for students who are found eligible in these areas of special education. But yeah, I hope you enjoyed. I hope you enjoyed. And until next week, this is Donna Steele signing out. Thank you. Bye.